Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. Today's episode is from the Clinical Glaucoma and Retinal Care channel entitled A Comparison of Inner Eye Macular Thickness and Contrast Sensitivity Asymmetry in Glaucomatous versus Non-Glaucomatous Eyes. I'd like to thank our host and topical editor, Dr. Andrew Rixon, and our topical expert, Sydney Gross. And now it's my pleasure to begin today's podcast.
Hi, welcome to this month's podcast for the American Academy of Optometry Foundation's clinical podcast series. My name is Drew Rixon. I'm the topical editor and guest host for the glaucoma and retinal care section. So our task this month was to, when we went to Academy, view different posters and find a poster that we thought was worthy of and aligned very nicely with our individual sections of the podcast. And this month's we've invited Sydney Gross from Midwestern University College of Optometry to discuss her poster. And her poster was a comparison of inter-eye macular thickness and contrast sensitivity asymmetry in glaucomatous versus non-glaucomatous eyes. And Sydney had presented this at the glaucoma super session. So Sydney, why don't you just kind of tell us a little bit about yourself and how the project came together and what the activities at Arizona College of Optometry are along these lines.
Perfect. Thank you so much for having me. So I'm a fourth year currently at the Arizona College of Optometry. And during our second year, we have to present, do research and then present a capstone project. And so we were split up into groups, and I had the privilege of working with my mentor, Dr. Sarah Huff, and then two of my classmates, Crystal Epling and Hannah Ling, on this project. And so we collected data during our third year, and then we presented at a little session during our school. And then my group decided to push this forward and take it to Academy as well.
Right. So, why contrast sensitivity? I think, a lot of times we're really pre-programmed in clinic to discuss only Snellen. So what was the impetus to start talking about contrast sensitivity and study that?
Yeah, so when we think of, glaucoma, there's the structure and the functional components. And so when we think of the visual function, we think visual acuity, of course, and then the visual field testing. And that can be long and monotonous sometimes, and it has a steep learning curve for patients. So my group decided to use contrast sensitivity, and more specifically the Mars chart, because it's pretty inexpensive to have in the office. It's user-friendly for both the examiner and the patient. And it's actually maybe a better test for visual function than visual acuity is. Newer studies were saying. So we added that into our study.
Great. So what summarize your findings, kind of break down the results, and actually kind of discuss who was involved in this as far as your controls as well as your glaucoma patients. Just kind of break that down for us a little bit.
Yeah, definitely. So we took patients from our glaucoma clinic at the school's clinic. And, we figured that they were already going to be there for glaucoma appointments. And if they were in the glaucoma clinic, they were either going to be suspects of glaucoma, maybe already diagnosed with glaucoma. So we would be able to pull kind of from that population of patients. We also tested normal subjects as well, so those that did not have any risk factors for glaucoma. And so we wanted to compare macular thickness to contrast sensitivity in patients of glaucomatous eyes, glaucoma suspects, as well as normals. And so we had kind of hoped to compare those two together. We were not able to statistically compare those two, contrast sensitivity and macular thickness. But what we were able to find was that macular thickness asymmetry was highest in glaucomatous eyes, and then contrast sensitivity asymmetry was also greatest in glaucomatous eyes. And so those two findings separate were statistically significant, but we did not end up being able to relate the two together. But we collected this data during a full class schedule, full clinic schedule. So our N value was pretty small. So going forward, there need to be some more controls to make this study a little bit more valid.
Right. Yeah, no, I mean, it's a good starting point, at least, getting the conversation going. In the glaucoma space, there's just so many things that we're dealing with right now, and there's a lot of noise with different testing. Do you see contrast sensitivity specifically with this Mars chart being something that, is something we can easily implement, but also something that would be adding value to us in clinical practice? So kind of just how does the OD in practice kind of integrate and then project going forward? How do you see it being used in the future based on this initial work?
Yeah, I think the hope is that contrast sensitivity testing could maybe be a screener almost, or some sort of an early indicator for potential glaucomatous damage in the eyes, kind of just as a quick test, almost as like an entrance testing test to run. So a couple of things need to be implemented better to the study, like I said, just to make it a little bit more relevant. But hopefully, if the study continues and with future studies, we'd be able to use that as a screener for early glaucomatous damage.
Right. No, it's really, really important work. I find a lot of times in glaucoma, there's so much emphasis on minutia at the like RNFL level, but there's very little talked about with patient quality of life and vision and different aspects of vision. So I really do think that this is important, and I really appreciate you joining us today on this podcast. And really, honestly, great job, Sydney. Appreciate you coming on today.
Yeah, thank you so much for having me.
Okay. Take care.
You too.
And a special thanks to CooperVision for their educational grant to make it all happen.